Hello, my name is Kristen. Me and my partner Miley Ho, we did our project of changes in aging on motility and safety in the elderly community. Just a brief introduction about our topic. One of the health-related changes that comes with aging is decreased mobility. There's many factors that may increase the risk for an older adult to be unstable when they're ambulating. Some of these factors include normal changes of aging, and some are pathophysiological changes and that are common in elderly patients. Just a brief introduction. Changes of aging that influence decreased mobility include an impaired gait that can come with common illnesses like Parkinson's disease that causes shaking, and impaired vision and balance. Again, just normal parts of aging. As people get older, they develop conditions like cataracts and presbyopia and stuff like that. Also, dementia, it can cause confusion, and a lot of times if people aren't familiar with their surroundings, it can cause them to be at a higher risk for falls. Altered level of consciousness, that can come from just general tiredness, or it can come from medications that cause drowsiness and lethargy. Urge incontinence is a big one. A lot of times elderly people have trouble controlling their bladders, and when they need to get up to use the bathroom and they're in a hurry, a lot of times trips and mobility problems arise. As I talked about before, medications, there's a lot of medications that increase confusion and altered level of consciousness that can make people drowsy and increase falls risks. Just generalized weakness. As people get older, their muscles deteriorate and they just have a lot of trouble with strength and moving around. A big one is orthostatic hypotension. A lot of times elderly people spend a lot of time laying down in bed. It's important since fluid shifts happen so quickly in elderly, and a lot of times they can already have low blood pressure, to make sure that they don't get up too quickly. A lot of times if they stand up too quickly, their blood pressure can drop, cause dizziness, and increase mobility problems. Some health concerns for mobility issues and safety. Of course, they're at an increased risk for falls and injuries. We should pay attention to some things that make their risk higher and takes steps to avoid accidents. Patients who are on anticoagulation therapy have a higher risk of injury from a fall. They're at a higher risk for bleeding. If they get just a minor bruise, it can bleed more than normally, and more importantly, if they hit their head, they're at a risk for brain bleeds, which can be really dangerous. Elderly clients are more prone to fractures, bruising, and skin tears due to the fragile nature of their tissues. As people age, they just become more fragile, and bone loss can cause fragile bones, and fractures are more likely, and they don't heal as quickly either. So a fracture, like a hip fracture or a arm or something like that, can take a long time to heal and be really detrimental to their health. And as I said, the frequent falls can lead to faster physical decline because it takes them longer to heal, and sometimes elderly people don't completely heal or come back from an injury like younger people do. Some trends in mobility. Mobility issues are probably one of the most common issues for elderly people. As people get older, it just becomes harder for them to move around and move around safely. It's important for them to have assistive devices, and there's actually about 40% of people over age 65 that have at least one disability that has affected their mobility issues. So it is a very common problem in the US. Some interventions really important that we can do to increase independence in elderly people. It's important to provide assistive devices, but more importantly, it's important to educate them on how to use them correctly, because if they're not educated, they can use them wrong, and it can actually increase their risk of falling and stuff. We need to be sure to clear walkways and clutter, and make sure there's no stairs, anything that can pose a threat to falling or tripping. We need to make sure there's sufficient lighting. That if you can't see, it's hard to move, hard to walk. Glasses are important so that they can see efficiently to walk and move around. We need to make sure we orient our patients and at home or in the hospital so that they know where to go and how to get to different rooms, like the bathroom, the kitchen, important areas of the house. And it's important to encourage safe activity within their limits. There's a saying, if you don't use it, you lose it. And a lot of times elderly patients with mobility problems tend to spend a lot of time in bed, and the less you move around, the more dependent you get on your bed and stuff. So it's important to encourage our patients to exercise and do range of motion. And now I'll pass it over to Miley.
Hi everyone, my name is Miley and I will continue this presentation. Other interventions for elderly patients for safety and mobility in the hospitals include make sure that IV tubing and poles do not cause patients to trip, move it out of the way, or any other wiring according to the bed or alarms. Make sure to monitor patients closely when they're on high-risk medications such as like a heparin drip or any other blood thinners or any other medications that cause them to be lethargic, like pain medications. Make sure you use your chair and bed alarms. Make sure they're properly on and working properly, so that way they are set off if a patient is confused or has a fall risk, so that way we can catch them before they fall or whatnot. Make sure to use a bedside commode if they're not ambulatory or you don't have the proper tools to get them to the bathroom, so that way they can easily use the bathroom without having to use a bedpan, so that they're more comfortable to use the bathroom. Always make sure call bell lights are within reach, so that they can easily access the call light, so they don't try to get up without calling us in the hospital setting or in the assisted short-term rehab or setting. Use safety devices like side rails, gate belts, and lifts when transferring patients. You want to make sure your patient gets transferred from the bed to the chair safely without hurting you or the patient. In a home setting, it's important to clear clutter in the patient's home. Sometimes they have a home health nurse or a physical therapy to make sure that there's no chairs that get in the way. They can easily access the stairway, or if it's too much steps, to use the side rails in the bathroom. They can use a shower chair for safe motility, or sometimes a patient needs a 3-in-1 commode so that they can access the bathroom easier in their bedrooms. Some teaching strategies for your patients include to educate the patient importance about safety to prevent falls. Like Kristen said earlier, falls can have a big health issue on their patients. Brain bleeds, they have a hard time healing back in the elderly community. Before you teach, make sure you assess for any impairments that may affect learning. The first thing you want to check for is hearing. If they have impaired hearing, make sure their hearing aids are in. Make sure that if they don't have hearing aids and if you feel like they need it, they go see an ear doctor. Or when you're teaching them, if they have trouble hearing, make sure you speak in a slow and clear manner so they can understand you. Assess for any vision issues. Make sure their glasses are on, or so that they can see the material correctly, and make sure the font is big enough so that they can read it clearly. For touch, some patients have issues with the sensory. They don't feel things like a younger person does. So make sure that you can assess how they feel things. Provide education in a well-lit setting with little to no stimuli so that they're not distracted by other things while you're providing their education. Assess the patient's level of knowledge before you provide education. See how much they know so you can see what you have to teach them, what direction you have to go to in this education. Some additional learning strategies include effective communication. You want to make sure your point or your education is being made across. After you teach them, tell them to return the demonstration to talk to them, or to repeat what you just told them so that they can understand, and also make sure that to provide additional education. Keep reinforcing what you just told them from the beginning to the end of your care. Be sure the patient understands the importance of education, why the education is being provided, so that they're just not getting bored and they just shove it aside for later on. Alternative care options. Usually when a patient is in a hospital or any other facility, what happens is they're assessed by physical therapy if we see any changes in their motility. Sometimes the physical therapist might recommend a home health care, so that physical therapy goes to them. They might recommend outpatient physical rehab, so that way they get a better motility strength, so that when they go home they feel strong and safe. Sometimes they will need to be placed in assisted living care facility, assisted or a nursing home, and so the social worker will help them on that. Or they might need a short-term rehabs or temporary things so that they can get stronger before they go home. And these are references. Thank you guys.